Prompt actions saves lives. And as we start out in the new year, a lot of us make plans for the year. We have our goals, we have New Year's resolutions, but I ask, what's the point of all of these things without health? Because, you know, life can just go like this. And unless you've been in a situation where you face a life or death instance or situation, you never quite understand how precious life is or how important it is for somebody to know how to respond when you find yourself or others around you in an emergency situation. And my special guest today has answers on how to respond to emergencies in public places. And hello, everyone, and welcome to Ibi Speaks. I am your host, Ibinabo Enebi. And listen, Happy New Year. Happy New Year. I'm delighted to see you. And this is the first episode of 2023. And I want to thank all my faithful viewers and all my subscribers. Thank you for joining me today. And I don't take your time for granted. And if you're a first-time viewer and you're wondering, what's this channel all about? My channel is about encouraging, motivating, and informing you to make better and intentional decisions for yourself. And I do this by featuring everyday people like you and me and thought leaders to share their stories and expertise, because I believe that collectively, our stories and expertise serve as streetlights and survival kits for those coming behind us. And today's episode, like I said, is the first installment of the 2023. And I thought to bring my special guest, Dr. Abiye Hector-Goma, to speak on prompt action saves lives. And he will share information that can save your life and the life of those around you. And guys, please, I'd like you to stay till the end because I have a big announcement. Now, before we delve into Ibi Speaks proper, I would like to give a brief introduction about my guests. And so just bear with me now. So Dr. Abiye Hector-Goma is the lead GP at Allerton and Westfield Medical Centers, Leeds, United Kingdom, and is passionate about helping people take responsibility for their health. He is a general practitioner involved in the provision of primary health services through planned and unscheduled consultation, preventative, promotive, and curative health services in the UK National Health Service. He has in-depth experience in primary care and cross-sectional collaboration for health, having worked in public, private, and voluntary community sectors. His special interest is in cardiovascular risk management and lifestyle intervention, patient safety, mobile technology in health, patients taking responsibility for their well-being, and tackling the broad determinants of health. Dr. Goma is a driver of practice improvement processes like organizing public health discourse in communities, churches, social groups on self-care and lifestyle intervention. He arranges health checks and special medical consultation for private health tourists and is actively involved in medical missions and cardiovascular health education, annual teaching visits abroad. Dr. Hector-Goma, welcome to Ibi Speaks.
Thank you very much. It's good to be here again.
Fantastic. And my viewers, you can be a part of this conversation by leaving your questions in the comment section below if you're watching via Zoom or YouTube. And yes, and if you prefer to leave a private message for me, if you're watching via Zoom, then you can send it to me directly. But most especially, and more than anything else, I want you to listen to our conversation today. Get your friends and get your loved ones to listen to this conversation, because you may learn something or learn something that can save your life and the life of someone around you. Okay, thank you. Now, Dr. Goma,
yes,
I want to start with you, but then I have a question for you, right?
Okay.
I've just looked through your CV. No, not really looked. I have checked. I study you like a book. And you see, I see that you have special interest in cardiovascular health.
Mm.
And just the other day, yesterday to be precise, Lisa Maurice Presley, Elvis Presley's only daughter, died of a possible cardiac arrest at the age of 54. And she was last seen at the Golden Globes Award. So she was alive this week, and then they lost her. So, assuming I have someone in front of me suffering from a cardiac arrest, what can I do to save that person's life?
Okay. I mean, there's the ABC, which is the mantra of saving people's lives. Emergencies have always been ABC and it's never changed. Everything is ABC. Primary education was ABC. So A is airway. For example, if you ask me, can you hear me? And I say yes. For me to say yes, it means that my airway is working. So the first thing you do is, if somebody has had a cardiac arrest, the first thing you need to do is you have to look around you to be sure that you're safe to go near the person. The person may have just had an electric shock, you don't know. So if you just go near the person and touch them, you could get shocked and you could die too. Maybe they've fallen and their leg is touching water, and that water is linked to some electric wires or something. So you have to scan the area very quickly to be sure that you're safe to approach that person. And then the next thing you want to do is you want to check the airway. So you shake the person and you say, are you all right? Can you hear me? And they say, I can hear you. Yeah, I'm okay. If that person has said something and you know that by just answering you, the airway is okay. The next thing you want to do is you want to check if the person is breathing. We'll talk about that in a moment, but the next thing is first A is airway, B is breathing. You want to, before COVID, that was something we did very quickly, but with COVID, we're now a bit more cautious. Before you kind of take your face near the person's face, you put your cheek, you want to see whether they are breathing. So the chest rises and falls. You want to put your cheek near their nose to see whether you can feel breath coming through them. So that's the next one, B. And then the third one is you feel their pulse, whether you can, you check the carotid to see whether you can feel. So it's A, B, C. A for airway, B for breathing, C for circulation. And that's just every kind of emergency situation you meet is airway, breathing, circulation, and there's D and E, which is something else. But remember, it's A, B, C, airway, breathing, circulation. You ask for help. So that's just the next thing you do. So if the person, for example, is breathing, you don't need to begin to ask for help or dial 999 if you're in the UK, 911 if you're in America, depending on whatever the emergency code is. If you're in Nigeria, you begin to look for a way to move the person because there's no such service really in most places. So it's A, B, C, airway, breathing, circulation.
Okay. Thank you very much for that. But I'm just wondering, and I'm very particular about home, about Nigeria, because you said that in Nigeria, we have no such, well, we do have, like people who live in Lagos, for example, we have the emergency response, but of course we know that Lagos traffic, before the ambulance gets to somebody's house, it takes forever. And so in a space of time where there is no ambulance, what can I do to save that person? Is there anything I can do?
Oh, definitely. The key thing is that if, for example, you've checked it and the person is not responding at all, and you check if they are breathing and they are not breathing, and then you check and there is no sign of circulation, you have to start what is called, we all know, CPR immediately, because the next 10 minutes are the most vital 10 minutes. I was just thinking before we started that everything has to do with the arteries supplying blood. Everything has to do with that. So is the compression CPR is what we need to do right away. So that's what we'll do. And I'll show you a clip. If that's okay, I can show you a clip on how you do CPR. I think that's really important for us to have a look at how CPR is done. Talking about it alone won't be enough.
Okay, I know that, because I know that, when we were thinking about this conversation, because this conversation means a lot to me personally, I just felt that we needed to do all that we could within our power to give our viewers the information that they need to save somebody's life. And so now we've talked about somebody saving somebody's life. I just keep having these questions, these scenarios, because I've lived long enough to hear things. Some time ago, some guy that I knew had chest pains. Now, I'm not a doctor, so I don't know the difference between a cardiac arrest or a what. I don't know the difference, but heart attack. But anyways, this guy was having chest pains, and they called the ambulance. And in the process of calling the ambulance, while the ambulance was on its way, he was in severe pain and he was given paracetamol to drink. And I think that kind of hastened and complicated the seriousness of his problem, and he died. So this brings me to the next question. If I come around, and anyway, this is what it is, right? So what's the difference between a heart attack and a cardiac arrest? And what can we do? You've talked about the CPR, but are we allowed to give medication to anybody that is having cardiovascular situations?
Okay, so you asked a very good question. What's the difference between a heart attack and cardiac arrest?
Yeah.
Heart attack is, as the two words imply, there has been an attack on the house, on the heart. It's like if you have robbers attack your house, it doesn't mean that they've killed you, but they've done some damage to your house. So heart attack means that there has been a reduction in the blood flow to the heart, and that manifests as pain in the chest. That's the classical. So somebody does this and then is in pain. That's a heart attack. Anybody who does this is a classical heart attack. Somebody can have a heart attack and be watching TV and not even realize he or she has had a heart attack. But the man or woman who clutches their chest in pain is a heart attack until proven otherwise. And it's only when they get to hospital, they do blood tests, they do ECG. If all those ones come back normal, then they could say it was gas in the stomach, which can present as if it's had a heart attack. But in the community, in the public place, anybody that clutches their chest, it is a heart attack until proven otherwise. Now, for that kind of person, if you had aspirin, 300 milligrams of aspirin, if you have that, and you give the person to drink or to chew, you can never be wrong, because that's the first thing that you can do for somebody who is suffering a heart attack. What you're trying to do, that 300 milligrams of aspirin is a blood thinner. What happens in a heart attack is that there's a clot which is blocking the very tiny arteries that supply the heart. So by giving that 300 milligrams of aspirin, it could make the blood a bit thin and give that person a fighting chance. So it's not paracetamol, but the paracetamol won't do any harm really, but it won't really make much difference in a heart attack. But with aspirin that you give the person, that begins to try to thin the blood and give the person a fighting chance. That's the first thing that you would do. So if you call 999 and then you give aspirin, if you have it. And of course, the same things about airway, making sure the person is breathing well. And then, the airways, person can communicate, and their heart, they are able to breathe in and out, and then they don't really look fatigued or have a wheeze or any other thing like that. But your first role then is call an ambulance if there is, give aspirin if you have it, and then either take the person if you don't have an ambulance, enter the car, if you have a neighbor, anybody, begin to go to.
Yeah, that is our own situation at home.
Yes.
So if assuming I don't have the 300 milligrams of aspirin, what can I do?
Well, even if you have, there's the baby aspirin is 75 milligrams.
Okay.
If you have aspirin, just give if you don't have aspirin, if you have paracetamol, it won't make any difference, but at least if it's better than nothing in terms that you're giving the person some pain relief. If it is not a heart attack, if it's just muscular pain, maybe the paracetamol would help. But if it's a heart attack, it won't really make any difference. But aspirin will be what you can give if you have it.
Okay. Thank you very much for that. Now, you know, I'm a student because I like to learn. So you've just said that the heart attack is a pain. Somebody could have a pain holding onto the person's chest, and somebody can also have a heart attack without even knowing that they have a heart attack. So what's the difference then between a cardiac arrest and a heart attack?
Okay, the difference is that with a cardiac arrest, the person's blood supply to the brain has come to an end. So the brain, as I'm flinging my hand now, my brain is what's making my hands to move. If I take my glasses off, it's my brain that's making me do that. So when there is a shutdown to the blood supply to the brain, the next thing that happens is that person would fall. If someone has a cardiac arrest, they'll probably slump. And that person, when you say, "Are you okay?" they will not respond because they've arrested. So the airway, there's no response. And when you check, they are not breathing. And when you feel, you don't see any pulsation. That is a cardiac arrest. For chest pain, a heart attack, the person is saying, "My chest, my chest, my chest. I can't, I can't breathe," but you're hearing the person. That's heart attack. You assume it's a heart attack. But when the person has slumped, and there is no response, airway, breathing, circulation, no response, that is cardiac arrest. And then immediately seek for help and begin to do cardiac compression right away. Because, like I said, I'll show you that little video clip. That is that person's fighting chance of maintaining blood supply to the brain, because you're pushing blood out of the heart and forcing it to go to the brain.
Fantastic.
So
we're going to look at,
and keep doing that until help comes.
Fantastic. We're going to do that. We're going to look at the, how to do the compression. But then there's another very interesting, or rather very important question. I'm not a doctor. I'm thinking about like a survivalist. So you've talked about what you can do to help somebody who has a cardiac arrest or a heart attack. But what if I am on my own and God forbid I have any of those situations? I'm having a cardiac arrest or heart attack. Can I help myself?
Well, yes, you can help yourself. If you are in a country where there's an emergency service, you dial, like if you're in the UK, you dial 999, and the operator will talk you through what is going to happen. The operator would immediately call the ambulance to come to you and then give you instructions on what you can do, making sure that if they know, it's like, at least they will tell you what to do. And the first thing you would do is to dial 999 and seek help. Perfect.
Now, thank you very much. When I wanted to do this, right, this particular topic, and I mean, this particular conversation will take us then now for you to give us the various situations and how we need help. I was saying to you, last year, 2022, was one of the most difficult years. I was in emergency 3 times. One of the times I had just finished a live episode of Ibi Speaks, and I was passing out, and my little girl, my 12-year-old, she was 11 at the time, had to call the ambulance, and they came for me. But she kind of like had the presence to call an ambulance, and they came and they took me to the hospital. So I was in emergency 3 times last year, and just towards the end of the year, and this is what just scared me. I had finished work and I was having a conversation with one of my colleagues. And in the process of the conversation, I choked on air, right? It was either spittle or air, but I had nothing that I would have known that I was licking my Mentos, okay? But I had finished licking the Mentos. I didn't choke on the Mentos, but something choked me. It was either air or spit. I don't know, but either of those two. And I started coughing. Initially, it was an irritating kind of cough, and then it got progressively worse. And then the people around me gave me water to drink. But I was drinking the water. I realized the water wasn't helping me. And after a while, I became very uncomfortable. I couldn't breathe. And I kept saying to myself, and I was like, somebody help me. I am dying. Somebody help me. I am dying, because I was like, wait a minute. I was conscious of what was happening to me. I was like, I didn't plan to die today. I had finished work. My daughter is at home, right? My child is at home. What am I like? What is happening? And I was doing that. Everybody was panicking, because nobody could help me, until one guy whom I was standing in front, unsure, said, you know what, Ibi, can I try this? Can I try this? And then he came behind me and he compressed my abdomen twice. And immediately he did that, I could breathe. And I kept asking myself, what if this boy wasn't there to help me? Because some people would, pardon?
Within your funeral.
Yeah, what if this boy wasn't there to help me? God forbid, it would have been like an evil arrow. But this boy was there to help me. And that is why I feel that it is important for us to know these things, how, in case something like this happens, how and what we can do to save somebody's lives. And so, Dr. Goma, we're going to talk about a few of these, and you have videos and write-ups. So I'm going to just leave you to educate and to inform my viewers about the things they can do to help save themselves and others in an emergency situation. Okay? So,
right.
have your way now.
Thanks. I mean, like just before I start, we all have car insurance, home insurance, life insurance. When we have those things, it's not because we are planning to have an accident, or you're planning to have a flood, or you're planning to have a long-term condition and all of that. But the truth is that those things do happen. You've just talked about the Heimlich maneuver. I have learned about it for about 40 years now. I know the Heimlich maneuver. I've never used it before. So the fact is that you can learn some things today and never get to use them. But it might be that you learn something today and then tomorrow you're faced with a situation where you use that learning and then you save somebody's life. So you don't even know. I mean, we do CPR, the pulmonary resuscitation. We do it every year. I think I've had to do it once outside of work environment in 40 years or so. So the point is, you may never use this information, but you might even be the first person to use it even before me that has passed the information to you. So let's have a quick look at a few slides. And like I said, we will show some. Can you see my slide? Can you see my slide? Ibi, you're off mic. Can you see my slide?
Yes, I can, but let me just move. Yeah.
So this slide just talks about, imagine you are in a public place.
Yeah.
You are in a public place, and one of those places, maybe in a 5-star hotel, or you're in church, or you're watching your favorite football team, and you're in a park or wherever, and then suddenly somebody has a seizure, or somebody has a heart attack or brain attack. We call it stroke or cardiovascular accident before, they call it brain attack now. Or someone is bleeding from their nose, bleeding from an injury, or like what happened to Ibi last year, you're choking, difficulty breathing, change in mental status, allergic reaction, and so on. So one of these things happened. So we'll have a look at some of them and see what we can do about it. So we'll look at a few audiovisual clips, just short clips, and then we'll kind of have a quick summary. So the first one I have here is brain attack. I want to just spend a minute or two talking about stroke. This mechanism is what happens in most of these sudden situations. There's a reduction in the blood flow. So imagine that this is the brain. So this is the carotid artery bringing blood to the brain. Imagine if there's something, there's a blood clot here somewhere. And this is what happens. You have fat buildup in the walls of the blood vessels, and then a clot forms. And because a clot has formed, the blood cannot flow through. And then there is now loss of blood supply to that part of the brain. Imagine if this is not the brain, but the heart. So it's somewhere down in the chest. Imagine if this is the heart. This is a coronary artery bringing blood to the heart. If we're looking at it from the heart point of view, the same thing happens. There's fats build up in the plaque build up, and then clot forms, and blood is not going to flow through, and that leads to a heart attack. So the mechanism is the same. People have acute renal failure. The same thing happens. There's a reduction in the blood flow to the kidneys, and the kidneys are starved of, that kidney is starved of oxygen and food, and you have acute renal failure. So look at any organ, it has to do most times, and that's why our lifestyle is important, because a poor lifestyle, fatty foods, little exercise, and other things can lead to the buildup of plaques, lead to clots formation at some point, and leads to reduction in blood supply. And this is the big mechanism in cardiovascular disease, in the brain, in the heart, in the kidneys, a reduction in the blood supply because of plaque formation. So if we just, so if you look at this, there's what we talk about in brain attack. When this happens and there's reduced blood supply to this part of the brain, which is shaded in yellow, it leads to drooping of the face, and that's F for face. Somebody's face droops on one side. So that's one thing that you will see. And then the next one is that when it happens to this part of the brain that's reduced blood supply, they're not able to raise their hand. So when you say raise your hand, this particular person is able to raise his left hand, but the right hand is not able to raise. There's nothing wrong with the hand itself. It is the brain which controls that hand. And that part of the brain is not working because of reduced blood supply. So he or she is not able to raise the hand. And then the next one is that if it affects this part of the brain, their speech becomes muddled up. So I want to say, if it's good to meet you again, I'll say, that's the kind of thing. So this is what the whole, of course, other things that happen, confusion, their vision may be affected, their balance may be affected, they just can't remember what they are doing if it affects different parts of the brain. But that just brings us to, so what could happen is that most times there is a blood clot so the blood flow is affected, or in some cases, particularly with those of us who have poorly controlled hypertension, the blood vessel can rupture, and that leads to poor supply of blood to that part of the brain. So for brain attack, they say when stroke strikes, act fast. F stands for face. Has it fallen on one side? A stands for arms. Can they raise their arms? S stands for speech. Is the speech slurred? And when you say slurred, falling face, can't raise their arms, speech is slurred, it is time to call for help. If you notice any of these signs, it doesn't have to be all of them. If you notice even one of these signs, dial 999 or 911 or whatever the emergency code is, because this person is having a brain attack. So that is the first one about fast. So you can see it. So you're with somebody and then suddenly their face is drooping. And instead of you to straight away call an ambulance, you're saying, hey, what's wrong with your face? It's not a time to say, what is wrong with your face? You know, FAST means call for help right away. And immediately you take action, and that can save somebody's life. One of my patients was telling me about 2 weeks ago, his son came into the house and he saw him looking slow. He asked me a question, said, Dad, the way he answered, I said, this was like a stroke. And he was right. And because the son saw it and then called an ambulance and he got to hospital within an hour of the incident, they're able to do what is called thrombolectomy. And that quickly saved the father's life. Otherwise, it would have been too late to do any intervention. So that's why it's important when you see FAS, immediately it's time to call for help. So I'll stop here at this point, and maybe I'll just go on to look at the slides. Let's just go forward and look at the slides on heart attack. I think it's a good one to look at this point. So let's start with this this video. Let's start with this video. technology won't fail me.
It won't fail you. Dr. Goma, while we're waiting for the video, right? You know, whenever so we're talking about advanced, you know, situations where we can call an ambulance. I'm talking about home in Nigeria, you know, or you know how it is. If there is no ambulance, or if we can't get the person to the hospital within an hour, is there anything we can do to at least save the person's life?
The truth is that in such emergencies, you have to get the person to hospital. Whether you're going to use, I mean, unfortunately, one of my uncles, God bless his soul, had some accident with acid back in the village. They had to put him in a wheelbarrow.
Hey.
And they used a wheelbarrow to take him from Ogoloma, if you know where Ogoloma is, all the way to Okrika General Hospital. That wheelbarrow journey took almost an hour and 30 minutes. And that's how they took the person there. So the point is, whether it's a taxi, a neighbor's car, whatever it is, you have to get in a vehicle and get the person to the nearest health facility.
Okay.
But then it becomes a bit challenging, because if somebody has had a cardiac arrest, doing that will be too little, too late. So maybe while people are going to look for a vehicle, if you are there, start cardiac compression. And if they put the person who has had a cardiac arrest inside a 404 Peugeot, and you can still continue the cardiac compression, it's better than nothing. And that's the challenge that we have in that part of the world, that if there is no emergency service to carry people straight from wherever they are to seek help, you have to just do that. But if somebody has had a cardiac arrest, you're supposed to continue to do cardiac compression until you're able to get either an ambulance or get them to a hospital.
And you know, the most painful of all of this is that sometimes you can get to the hospital and the hospital personnel are just not, are nonchalant.
Well,
they can say, we can't take this person.
Yeah.
We can't take this person. But anyways, let's go on with our conversation.
Okay, so let's have a look then. Let's have a look at this first one.
Organ.
Can you hear
it? Works hard for us every second.
Yes, I can.
Okay.
Delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only...
Sorry, I was just getting a message that you're not seeing the video.
Yes.
But
I was listening anyway, so.
Okay. Can you see the video now?
Oh, yes.
All right. Sorry, let me just take this again, just take it back a little. So,
okay.
Yeah. So let me just take it from here. It's good.
Pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can and don't give up until medical help arrives or an AED is present. You can do it.
Right. So just remember what she said. You are their only hope. So keep doing the compression until either a defibrillator arrives and they can, or somebody help comes from.
You're going to see is from Steve's actual save. A real person who is alive today because of an AED and some good Samaritans who took action.
Okay, so so you are the only hope is really important that we get it right. And you can see the example she's given. If we don't press deep enough, the blood will flow just to the neck. It doesn't get to the brain. And if you press too fast, again, the blood does not get to the brain. So about 100 to 120 compressions a minute, and has to be deep enough, about 6 centimeters deep enough to push it well enough to get to supply the brain. So that's why, like you said, I mean, sometimes people's ribs get broken. A broken rib of somebody who is alive is better than the good normal ribs of somebody who is put in the grave. Of what use is good ribs if you're dead? So it is better to do the compression right, deep compressions, 100 to 120 per minute, and you are that person's only hope. Because if the ambulance comes in 20 minutes or even in 10 minutes, and you've done nothing in those 10 minutes, that brain is dead.
Dr. Goma.
That's just the key thing here about compression. Like you go to the ABC, is ask for help, and straight away you start compression.
Dr. Goma, I'm a very realistic and pragmatic and the theorist. You know, I reflect, I'm pragmatic, I'm a theorist in my understanding and viewing of things. And I am listening to you and I'm saying my hands are so thin and small. And if I come across somebody who needs to have that CPR, how would I, because now I'm listening to you and I see that it could be that you, in your mind, you're doing a CPR and you're not getting it. Either you're not going into the 2 inches deep, or you're not doing it properly. So if you don't do it properly, then it's as good as not doing it at all. So how will I know that I am doing it properly?
Well, the first one is, there's what is called knowledge, skills, and confidence. You can have the theoretical knowledge that, yes, I have to do 30 compressions, 2 rescue breaths. That's the theory. I have to do about 100 to 120 compressions in a minute, and I have to go about 6 centimeters deep. That's the theory. That's the knowledge. But you have to practice it. And this is where having formal training comes. When you have formal training, then that formal training gives you the actual skills to do it. So it's like the piano. You can read all the piano books. You put your hand on the keys and play, you've not learnt it. And this is just to kind of whet your appetite and have formal training. Now I can show you one more video, which is a virtual reality video, which is one of the ways by which people can get to practice the remotely. You can get to practice what we've just talked about. Let me see if I can find. I think it's just important if I can show this. Okay, how to do CPR. So this is something that is being taught in school. So if it's okay, if you don't mind, let's just have a quick look at this. This will kind of answer your question, because when you practice it, then you get to know that it's working.
Okay.
Yeah.
Lifesaver VR is an interactive VR film for teenagers where you have to save someone's life.
We can't see the video. Okay, good.
What about now?
Okay, good.
Can you see it now?
Because
yes.
Much more
Okay.
like you're in the situation and like it depends on you rather than just being told or watching it on TV.
At the start of Lifesaver VR, a group of friends are relaxing when one of them, Harry, collapses with a cardiac arrest. He will be dead in 10 minutes unless you do the right thing. Guys! What would you do? Run to help Harry now, or check for danger first? Watch out for the glass! You interactively control the actions of Harry's friend Chloe as she tries to save him. The film experiments with different forms of VR. This first half is shot like a regular film, but you watch it in VR cinema mode on your headset. No, it's just mobile. You make choices by turning your head to put a red circle over the option that you think is right. Exactly. He might choke. In the second half of the film, you have to make more choices and do CPR. For this, we go into full 360 video.
So here you can see how good your compression is.
No, I felt that I was doing it myself, whereas in a video, somebody else is doing it. There was one point when I thought there was no hope, so I thought I was going to cry. Let's do it.
Make wrong decisions, or your CPR speed is bad, then Harry will die.
He's breathing normally, he's waking up.
But if you do the right thing, you'll sense the thrill of saving a life. Lifesaver VR uses virtual reality to put teenagers into the world of a film and change that world. and it gives them the skills to save others in real life.
Okay, so back to your question, Ivy, how do you know that your compression is right? There are two things. One is you kind of you learn to put your hand, when you look at the person's chest, you learn to put the hand in between, and then you interlock. And the other thing is that your elbow has to be straight. So if you're doing this, it's not going to work. It's something like this. So, but if you do something like this, you're not going to put enough pressure. But if your hands are locked and then you can see your elbow is locked, so you're almost like a straight, your arm is straight. So you're putting your weight down like that when you're doing that. So that's just the difference. And that is when you have the actual learning. Your instructor shows you how to put your hand. It's not going to be a 45 degrees, but the arm is straight down like that. So that way, the pressure. And then when you're using a mannequin, the mannequin compresses. So if you're doing it right, you actually hear the click of the mannequin going down deep enough. And it's from practicing, then you know when it's deep enough. And with VR, if it's deep enough, you see good. If it's not deep enough, you know, you need to put more pressure on that. And that's the advantage of having the VR there. But the key point is you need to ensure that your elbow is not bent like that, and you put your weight on it. But again, it's only when
can you stand on the person's chest and just go jump, jump, jump?
No, you don't want to do that. I mean, let's see. But so the key thing is you have to go through a formal training for you to be able to do it right. That's the key thing. But I guess what we are doing today is just to tell us that getting to do CPR, learning about it and doing it will save somebody's life. Maybe this will encourage all of us. At many places, many workplaces, like in my office, every year we get somebody in and everybody goes through CPR training in the practice. So St. John's Ambulance, British Red Cross, many people do CPR training. I think it's worth investing the time and having trained. You might be in an airplane, you might be somewhere, and you might just be the one person that can save an individual's life. Yeah. So that's CPR. Any comments before we go on to look at something else?
Any questions? Okay. All right. I think we can continue. So.
Okay. So let's have a quick look at seizures. So this is another video of somebody having a seizure. Can you see the video?
The video is not out yet.
All right, let me just bring it forward.
This session is about what to do when someone has a seizure. Electrical activity is
Okay, I'm sure you can see it now.
happening in our brain all the time.
Can you see it?
A seizure happens.
Yeah, I see that.
Okay.
Intense electrical activity. We call this epileptic activity. Not all seizures cause a person to shake. In fact, what happens to the person depends on where the epileptic activity happens in the brain.
So just look at tonic-clonic seizure, which is one of the seizure types.
Okay.
Widely recognized generalized seizure. There are two phases, tonic phase, followed by the chronic phase. During the tonic phase, the person loses consciousness, their body goes stiff, and they fall to the floor. During the chronic phase, their limbs jerk, and they may lose control of their bladder or bowels. This happened. Tonic seizures. Assess the situation. Are they in danger of injuring themselves? Or nearby objects that could cause injury. Cushion their head. with a jumper, for example, to protect the head of you. Check the time. If the seizure lasts longer than 5 minutes, you should call an ambulance. Look for a medical bracelet or ID card. It may give you information about the person's seizures and what to do. Once the seizure is over, put them on their side in the recovery position. Stay with them and reassure them as they come round. Never restrain the person, put something in their mouth, or try to give them food or drink. Call 999.
Okay, so the one point I want to make here is that I'm sure many of us are used to getting a spoon and putting padding on it and putting it in the mouth of somebody who is having a seizure. And that's something that we did traditionally, or that's the old way of doing it. But it is not a good thing to do. When somebody is having a seizure, the muscles contract, so their tongue will not fall back and cover the airway. If somebody has a cardiac arrest, everything stops. So their tongue goes limp and their tongue can fall back. And that's why one of the first things you do is you lift the chin and you clear the airway. In a seizure, that won't happen because the muscles are contracting. Can you put yourself on mute if you...
Please, can you put yourself on mute? 1 second.
Put yourself on 1 second.
What's happening now?
Okay, so...
1 second. Let me just check. There's something not right.
Just check. There's something not right.
Give me a second, sir.
You know if it's the person's first seizure. You know if it's 5 minutes.
Okay, is it okay?
Okay.
Okay, is it okay?
Hello?
We can hear you.
Hello?
We can hear you.
Can you hear me?
Yes.
Can you hear me?
Yes.
Okay, I just 1 second now.
Okay, 1 second.
I don't know what's happening. Are you on YouTube?
Are you on YouTube?
Sorry, who is that?
There's someone who's not muted that is echoing you.
Thank you. I'll just see.
Just mute everybody and then...
Okay. Everybody on this. Okay.
Mute Okoite now.
Okay, I want to meet him. Okay, it's muted now. Yeah.
All right.
Thank you.
Right. So just to recap, knowing what to do is important. And knowing what not to do is equally important to keep a person safe during or after a seizure. So when someone is having a seizure, don't try to stop them. Sometimes we hold the person down. Don't try to stop the person or the movement. Let the person go through the seizure. Do not put anything in the person's mouth. They can injure their teeth or the jaw, and they cannot swallow their tongue when they're having a seizure. Do not try to give mouth-to-mouth breaths. You might lose your mouth in the process. Not offer food or water until that person is fully alert. Most seizures will end within a minute. If a seizure lasts for longer than 5 minutes, then call an ambulance. And somebody who is having a first seizure, particularly in this part of the world, you need to get an ambulance for a first seizure. But if somebody is known to have epilepsy, you don't have to call an ambulance every time somebody has a fit. It's only if it lasts. For a known epileptic patient, just be with them and make sure that they have a safe way to get back home and not drive themselves. If the fit lasts for more than 5 minutes, then that's why it's important to kind of time the fit. If it lasts for more than 5 minutes, then call an ambulance. So that's about the seizure. I can quickly mention an asthma attack. don't let somebody who's on an asthma attack lie down. Try and keep them straight up so that they can use their chest freely. Try as much as possible to keep calm. I remember when I was in first year medicine back in 1982, my teacher said, in case of an emergency, first check your own pulse in case of an emergency, because sometimes you may even panic more than the person who is having the asthma attack. So try as much as possible to keep calm yourself, and then get the person to take one puff of their reliever, the blue one, every 30 to 60 seconds, up to a maximum of 10 puffs. And if after that they are not feeling any better, at that point, dial 999 for an ambulance. If the ambulance is taking more than 15 minutes and they still have an attack, then go through that one puff every minute, again up to a maximum of 10 puffs until the ambulance arrives. And if in the process the person's heart stops beating, then you put them flat and then start CPR until the ambulance arrives. So that's just a brief on having an asthma attack. And if somebody, of course, who you know has asthma, has his or her blue inhaler, and when they're having an asthma attack, be calm and then go through the process of one puff of the inhaler every minute. If you know a bit about asthma, make sure that their technique is right, how they're using the inhaler until help arrives. So that's the bit on asthma attack. I'll skip the one on drowning. The choking, you've talked about already, and this is the point. It's been said that when somebody is choking, like you said, in your case, it probably was a drop of water.
It was air, yeah. It was
Yes,
air, choking
has gone
air.
into the wrong place. Sometimes what happens is that to protect the lungs, the muscles in that area go into spasm. And when that happens, you now find out that you can't even breathe anymore. As long as somebody is coughing, it means that they are doing their best to get whatever the irritation is out. But when that person's cough becomes weak and they're no longer able to cough, then it means that at that point, they need help. So that's where the airway comes. Somebody's airway, somebody, like you said, you asked for help, which means that at that point, your airway was still working. When you go to a point where you can't even say anything again, at that point, the person needs help. Where the voice is now hoarse or you have stridor, the person needs help. And it's a 5 back blows followed by 5 abdominal thrusts, which is the next thing. You do 5 of the back blows and it tells you, get them to lean forward a bit, support, use one hand, one hand to support the chest in front, and then, so use one hand to support the chest in front, and then use the heel of the other hand to give them a hard slap right in the center of their back with the heel of the hand. You actually feel the pressure of what you've done. It's not trying to be nice and gentle. It's a sharp, and then you feel the pressure of your heel, and you do it 5 times. And if you do it the first time, nothing happened, you have a look, nothing happened. When you've done it 5 times, then you go on to do the abdominal thrust, which is a Heimlich maneuver. I think the next slide shows that even better, and it shows how it works. This is where the pressure of your clenched fist pushes the diaphragm upwards. And when that happens, the lungs are forced to collapse. And that puts pressure in the trachea. And that pressure in the trachea is what now pushes whatever is causing the obstruction out of the way. So the first one is the back thrust, which tries to do the same thing. If that doesn't work, so this raises the diaphragm, causes the lungs to compress. So there's marked increase in the pressure here, and that pushes the foreign body or the obstruction out of the way. So you just do it 5 back slaps, 5 abdominal thrusts, 5 backs. Of course, by then you will have also asked for help, got an ambulance. And while you're doing that, something flies out and the person is grateful to you for life. That's fine. So that's just the Heimlich maneuver. Again, practice makes perfect. You can see how it is done. Position the thumb side of the fist 1 inch above the belly button and well below the tip of the sternum. So above the belly button and below the sternum. And then you thrust the fist inwards and upwards. So inwards and upwards, and you do it, and then you check if there's any response. You do it up to 5 times, and then you go back to back slaps. And that's one prompt effort by the person with you was what saved us from one other thing to seeing your beautiful face addressing us today. And that's why they say whatever knowledge you have, you don't know when you'll use it. Have the knowledge, and if that time comes, just do it. The truth is that you may say, I've never done it before. Am I going to do it right? If you don't do it, the person will die. If you do it, it just might save the person's life. So when you look at it, it is better to attempt what you know instead of not doing anything and then watching the person pass away. Okay, so bleeding. The key points about bleeding, I just want to mention that, again, traditionally, we are taught that if somebody is bleeding, you kind of put a very tight tourniquet, to really tighten it and stop the bleeding. So while you still apply the tourniquet, the key learning point here is that it should be tight, but you should still be able to get a finger between the skin and whatever bandage you are using. If it is so tight that you can't even put your finger, that could lead to damage to tissues. So apply the tourniquet, but not so tight that your finger can't go underneath the bandage itself. That's the key difference between what we were taught 10, 20 years ago and what the advice is. So put direct pressure to the wound, so you can put a pad directly on the wound and then tie it round. And then when you put that knot, let it be tight, but you should be able to still put a finger between the bandage and the skin. And then raise the injured limb to help reduce the blood flow. So by raising the limb, you reduce the blood flow there. I just want to make a quick mention of nosebleed. And there's a little video here, again, just to see how these things work. It's a small video about a child having nosebleed in terms of what to do about that. Sorry.
Dr. Goma, while we are waiting for the video,
yes,
I want to ask you this.
Okay.
Traditionally, right, people used to say that if somebody is in a severe situation, maybe an accident or something, and the person is asking for water, give me water, should we give the person water, especially when the person is bleeding? Let me put it this way. So you're in an accident scene and then you see somebody severely injured and the person's like, I want water, I want water. Should we give them water?
I mean, I think it would be a bit risky because somebody might be conscious this minute. You don't know if they've hit their head, and in the next moment they may be unconscious. So if they ask for water and you give them water, and let's imagine they became unconscious, then there's that little chance that they could aspirate. But if the accident is such that it's not a major trauma where the person has bruises on their head, maybe the person just has a wound on the leg, but otherwise from the head to the shoulders to the chest, everything looks fine, then you can give water. But if somebody has had an accident which is so severe that they have bruises on their head, their faces, their head is swollen or something, I wouldn't give water because they might lose consciousness. And if they have a full stomach from the water you've given, they may aspirate. So I wouldn't give water at that point, yeah.
Yeah, okay. And why don't they give, this is just another question out of curiosity. When a woman is having a baby, at the time of the baby popping out, why don't they give water? Because I remember I was very thirsty when I was having my first daughter. I was screaming for water and they refused to give me water.
Well, I saw Professor Ogu just now. She's a professor of gynecology. Maybe she can answer this question.
Okay, Professor Ogu, please answer this question because I've been very curious. And rather than give me water, I think they gave me ice block.
don't know if she's still here.
Okay.
No, I'm here. You're saying that they should give you water or they should give you ice block or what? What's your
No,
question?
I mean, when I was having my baby, the first daughter that I had, I was very thirsty and I wanted water. They refused to give me water. I was at the tip of having the baby. And then the second time, my last child, I was very thirsty. They didn't give me water. They gave me ice blocks. So why don't they give water?
It's to prevent an aspiration if it happens. If you take water and your stomach is full, and you want to vomit or you could vomit. Vomiting is quite common during the childbirth process. So to ensure that you have an empty stomach, nobody wants to give you anything to take by mouth.
Okay.
So when you say you're thirsty, you just say, wait, you'll soon deliver. Once the uterus is empty, then you're fine. But they could give you ice block in the sense that it's blocked. It's just to put something in your mouth, cool it. So it's the sensation. If the sensation, so you're not really taking water, actually. You're not drinking. You don't want the ice block to melt and you swallow it. It's all to prevent aspiration because the complications following aspirations are quite fatal.
Okay.
Well done, Dr. Goma.
Thank you very much, Doctor. I appreciate it. Okay, Dr. Goma, are you ready?
Yes, I am. So it's a short video.
When a child has a nosebleed, pinching the soft part of the nose will help the blood clot. Leaning them forward will prevent blood from entering.
So I'll just take that again. Okay.
Your nose is bleeding. When a child has a nosebleed, pinching the soft part of the nose will help the blood clot. Leaning them forward will prevent blood from entering the child's airway or stomach. Ask the child to breathe through their mouth.
Okay, so that's a short one, and it's always good to understand why you do what you do. So you pinch,
to do like this or to do like this.
Yeah, well, that's what she just said. If you do what you did the first time by going backwards, the blood is going to go backwards, and if it goes backwards, they kind of end up aspirating. So,
but they always tell people, raise up your head, raise up your, oh my gosh.
So that's so at least you understand why you are leaning forward is to prevent the blood from trickling backwards. And if it trickles backward, it can go into the wrong place.
So we've been doing it wrong all the time.
Well,
thank God for this program.
Reason. So that's it really. You're supposed to, the pinching the nose helps the blood to clot. But then you lean forward to prevent the blood from going backwards. And in that situation, it could trickle into the airway instead of going into the stomach.
Fantastic. I learned something new today.
Right. So I'll stop here. Any other questions or comments?
Okay, Dr. Goma, yeah, so we still have a few minutes. What about when somebody suddenly collapses? Because we always hear, so we've talked about cardiac arrest, we've talked about stroke, brain attack. We talked about what was it again? Seizure. Yeah. And we talked about sudden heart attack. But what if somebody just slums? Is the slumming the same thing as all those things?
Yeah, when somebody slums, the question is, you don't know why the person has slumped. So I think we'll just go through this slide. Somebody suddenly collapses, and the question is, well, like the same thing happens. You have to keep safe yourself because you don't know what has made them collapse. So check for any danger around you and try to rouse the casualty. When you're sure that it's safe around the person, you hold the person by the shoulders and give a hard shake and shout, "Can you hear me?" The person says yes. That means that the airway is working. And then you can ask questions, what happened? The person may now tell you, oh, I'm diabetic. I took my insulin. I forgot to eat. So straight away, you realize that probably they have low sugar levels. And if they are talking and you feel they're okay, you can give them sugary drinks. But if the person looks drowsy, is not responding, it's not safe to give them that. So you need to look at the other options. So that's the first one. If you get no response, then simply tilt their head back to help clear the airway. And this might just be enough, because if the person has a sudden collapse, the tongue falls back and blocks the airway. You tilt their head upwards, move the tongue out of the way, and that alone might be enough to get them to start breathing.
Oh my gosh.
You know that they are breathing, and then what you do now is to put them in the recovery position. But the person says nothing to you and there's no response. At that point, you know that you raise the chin, you clear the airway. So the next thing you want to do is that you put your face near their cheek, like we said earlier on, to see if you can hear or feel their breath. And then at the same time, you look along their chest to see if the chest is rising and falling. If you can't feel air on your cheek, and you can't hear any breath sounds, and you can't see their chest wall rising and falling, that tells you that that person has airways not working, they are not breathing, and then you feel the neck. But if the person is breathing but unresponsive, then you put them in what is called the recovery position. And this is just the details of how to put somebody in the recovery position. And then once you put the person in the recovery position, you lift their chin a bit again to clear the airway.
Wow.
So that's for the person who is breathing but unresponsive. So this position is kind of the key way for somebody who is breathing and is unresponsive. Just turn them to their side and make sure that the airway is open. And that's it, really.
Fantastic. Now, there's a few more questions I want to ask you.
Mm.
And what if, recently a Nigerian artist, Davido, lost his son. It's such a traumatic thing. He lost his son, and the young child drowned. So assuming you find, and children can drown, even in bathtubs. The bathtubs, a child can drown. Okay, I have a question here, but then let me just ask you this question first, and then we'll ask the question. And so, how can we do to save somebody who's drowning?
Well, the first thing is somebody who is drowning. Probably there's air in the lungs, and the first thing, going back to the ABC again, the first thing is you have to lift the chin and clear the airway. And for somebody who is drowning, you have to give 2 rescue breaths, because we talked about the chest compression, in terms of cardiac arrest. That chest compression, what you're doing is the heart has stopped beating, but you want to try and get the blood. Remember that diagram of the carotid arteries taking the blood up. But for somebody who is drowning that you brought up, it's most likely that person, oxygen has failed for the drowning person. Mm-hmm. So the first thing you need to do is to give the person 2 rescue breaths, and that's something that you have to decide. If it's a child, for example, I don't think anybody would think twice about giving a child 2 rescue breaths. So you raise the head up, you put your mouth over the child's mouth, and you blow long, and just watch the chest rise. You do that twice. And once you've done 2 rescue breaths, then you begin to do CPR. And many people, when you begin to do CPR, it might be that the pressure of the CPR will make them vomit, and then lots of, water they may have swallowed comes out. But the first thing you do is, once you've checked it, there's no danger, you brought the person out. For that child, you have to give the child 2 rescue breaths, put some air into the child's lungs, then you start CPR. So when you start CPR, the blood that is there, your air has gone in there, and there'll be some oxygenated blood being carried in. Otherwise, your CPR would fail, because it might be that there is no air in that person. So 2 rescue breaths, and then start CPR, 30, then 2, 30, then 2.
Does it work for children, for adults as well?
Sorry, I mean, okay, with depending on how old the child is, I mean, there are different things you do. You know, with the adult, you lock your fingers and then you do the breaths. You know, use the heel of your hand, lock the fingers, make sure your elbow is straightened. With children, depending on how old they are, you may just need to use 2 fingers and do the compression. It all depends on how big the child is, but it's 2 rescue breaths and then 30 compression.
Fantastic. For both adults and children, 2 rescue breaths. So there's a question here. Does it matter which side you put the person on in the rescue position? This question is for somebody that is conscious, is unconscious but breathing.
Yes, it's always the left side. You move the person to the left side. So what you do is, first of all, let me sorry. So you first of all put you are on this side. So you put this hand at 90 degrees first, and then this arm, which is on the other side, you put the palm of just under the person's left cheek, and then the leg, which is the right leg, you bend it to 90 degrees. The person is flat, so you bend it to 90 degrees. And then you put your arm on the shoulder and your arm on the leg, and you just turn the person over. When you turn the person over, the person's head falls on the cheek, and the cheek helps to stabilize, kind of give a steadiness to the head. And then you pull the jaw up a bit to make sure the airway remains open. And that's just how to put the person in recovery position on the left side. So the arm nearer you put it at 90 degrees, you bend the other arm and put the dorsum of the flat of the hand against the cheek. You take the right leg and then you bend it to 90 degrees, and you put it one arm here, one arm there, and then turn the person to the side such that you can see the cheek is is on top of the right arm, and then the right knee is in this position.
Fantastic. Dr. Goma, there's still so many questions I want to ask you, but the one thing that I've learned so far is this thing about, the way, and you just said it, in the village, in Okrikan, even at home, when somebody is choking, somebody is unconscious or something, the first thing they do is to put a spoon into the person's mouth, or you put a spoon across the person's mouth to make sure that, I don't know why we do it, but that's just the first instance. And you're saying, don't do that. And thank you very much for the information for when somebody is drowning and all of that. Now, allergic reactions. A friend of mine told me a story that scared me. Her husband and one of her sons can't eat peanuts, cashew nuts. Like if they eat that, it's very, very drastic. They have very, 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 very life-threatening reactions. So assuming somebody comes to my house and has an allergic reaction, what do I do?
Right. The story is the same. It's ABC: airway, breathing, circulation. But somebody having an allergic reaction, most fatalities from an allergic reaction take place between 15 to 30 minutes.
Really?
Most fatalities in an allergic reaction take place between 15 to 30 minutes. So time really is of essence in an allergic reaction. I think, let me look at this slide. I mean, there's allergic reaction, there's anaphylaxis. So the difference is an allergic reaction, could I say if you take it from 1 to 10, anaphylaxis is like number 10, and then allergic reaction is something less than that. So what happens is that people who are known to have allergies, many of them have EpiPen or something like that. They carry along with them some, EpiPens. So if somebody has a history of significant allergy and has an EpiPen or whatever they use, it's adrenaline, they need to use it right away. And many of them, they know exactly when to use it. So if somebody has an allergic reaction, if they're in your house, if it's a mild one and they don't have anything, at least what you have is what you can give. If you have antihistamine, you give them antihistamine, but you need to seek help. Make sure that their airway is fine. Make sure they're breathing. Make sure that they are not looking in shock or confused or turning blue. People that have an allergic reaction, if they begin to see things like swelling of the eyes, swelling of the lips, and they are struggling to breathe, that's 999. You have to get an ambulance straight away. If they have an EpiPen, they need to use it right away and then call an ambulance so that they can get to hospital and then they take things forward. Because when they arrive, they will do other things. But for you, happening at home, if they have EpiPen, let them use it right away.
What's EpiPen? Is it a medication?
It's adrenaline, yes, it's adrenaline injection, which they can just stab their thigh and use. But if there's nothing, if you have Piriton, give them Piriton and then just seek for help.
Again, I bring you back in the country where we don't have all of these immediate responses from the ambulance. What do we do? Some people will say, give him palm oil to drink. I'm just asking.
Yes, there is something we are taught in medicine. If you can't help, don't harm.
Okay.
What you need to do is to get that person to hospital. That's what you need to do. And in the process, ABC, airway, breathing, circulation. For someone having an allergic reaction, they have to go to hospital. There's nothing, if you have Piriton at home, that's the best you can do. But if they are struggling, their airway is not great, they are not responding to you, then you don't want to give them anything by mouth. Giving them Piriton with water will do them more harm than good. So at that point, just find a way to get them to hospital, try and keep the airway open.
Fantastic. Thank you so much, Dr. Goma. And listen, if you have any questions, please feel free to ask. And just quickly now, I have a very, very important announcement. On the 28th of January, 2023, at 6 p.m., I would have the second edition of my program, Refresh to Relaunch. Last year, Dr. Goma was a guest speaker, and this year I have 5 guest speakers that you've got to listen to, and the theme is Make Hay While the Sun Shines. I have an expert on retirement. I have an expert in transition. I have an expert, a business, an executive coach. I have an expert and a consultant on old age medicine. I also have an expert on mental health. It's going to be on the 28th of January, 2023. I would have the details on my social media handles, Ibinabo Enebi, on Monday. You have to register for the event on Eventbrite. I would have all of those details, and I don't want you to miss it. Now, if you enjoyed this episode of Ibi Speaks, and if you haven't subscribed to my YouTube channel, please subscribe. It is Ibinabo Enebi, or you can just check Ibi Speaks, Ibi Speaks, SPEAKS, and you can see, you can watch it. And listen, if you were blessed, if you found this program to be informative, kindly send the link to your friends and family, because you can be the person that can save somebody's life. Dr. Goma, we have just 6 more minutes. And listen, if you have any questions, please feel free to ask. I can see a few people here. Listen, I just want to say thank you very much for joining us today. I see Angela, I see Christina, my cousin. I see my pastor, Pastor Godson. Thank you so much. I see Ibi Fa. I see Dr. Goma. I see your wife. I see Olayinka Otoye. Rita, Dr. Mary Ogu, thank you so much. I see, of course, my darling husband, Mr. Sonny Enebi. I see Tam Theophilus. I see Thankful Tara. I see Yvonne Odibo. I see your sister Ibiama. And you know, a lot of people actually joined. They joined before the program, but then there was nothing I could do because the start time was 6 o'clock. And listen, it's been a fantastic outing. And Dr. Goma, any last words? Yeah, I want to ask one question. Concussion.
Yes.
As somebody, you know, the way children are playing and a child now hits the head. Bam.
Okay, there's head injury advice. I mean, the key point is each one is loss of consciousness when the event happened. Is it, or the child lose consciousness or not? And 2, did they throw up? Was there any vomiting? And then 3 is, are they sleepier than usual? You know, if their child is normally the child are running up and down the house and then they spend the time sleeping. So vomiting, loss of consciousness, and then looking confused or being more sleepy will require you to kind of have, you know, an assessment. But giving the child some paracetamol and looking out for vomiting, sleepiness, and how they are otherwise, is the key thing to look out for.
Okay, so vomiting, sleepiness, and how they are otherwise.
Yeah.
But I think for me, I would go to the hospital.
Well, the point is that if that child, for example, when that trauma happened, the child did not lose consciousness, they did not vomit at the spot, and they are back home and they are their normal self, that is the things to look out for. But if you had that for about a minute, he lost consciousness, he vomited in school, or when that happened, he's back home, he's vomited again.
Wow.
That's the kind of thing that is red flag that you need to take the child back. But no loss of consciousness, no vomiting, he's happy running around, he has a big bump, use an ice pack and see how it goes. I won't rush up to hospital for that.
Okay, I just have one more question here. Someone says Rigel. Is it Rigo or Rigel? Someone has Rigel, shaking.
Well, the key thing is that the reason of why Rigel happens is that the body sets the part of the brain that is in charge of temperature. The thermostat is set at a higher level. So normally by the time your temperature is over 38, you feel feverish. But when it's at a higher level, it has to get up to 40. You now find yourself, the temperature is 39, but you're feeling cold instead of feeling hot. So that's when you have the rigors. So the key thing is that if a child has high temperature, you use paracetamol and see how they go. If 2 hours after paracetamol, temperature is still high, sometimes they give ibuprofen. So you give one or the other. If there's no response, temperature remains still very high, then at that point you should seek help. You know, and then you need to look at what other signs are there. Does the child have a rash, any headache, any abdominal pain, and things like that? But the first thing is give the child something to bring the temperature down. Now, back home in those days, we used to use tepid sponge, you know, use something. Again, we advise against doing that. Instead, dress the child down and then open the windows, let cool air come in, but don't use tepid sponge to bring the temperature down, because it has we now know that causes a different problem. Give paracetamol or something, dress the child down, open the windows, let cool, particularly here, let cool air enter the house.
Dr. Goma, you know, I just learned something. You know, in those days when the child has, you go and look for ice block.
Yes.
Wow.
Yeah, when you do that, what happens is that the blood vessels to the skin close down. So when they close down, nature makes that the blood vessels open up so that the heat can go out through the skin to reduce the temperature. When you apply cold, the blood vessels close up, so the heat remains within the child. And that is what, of course, medicine has taught us, that those old habits, some of them need to change.
Oh my goodness, fantastic. I learned a lot today. Dr. Goma, thank you so much. Angela says thank you. Listen, and I want to say thank you to everyone who stayed tuned. If you need to rewatch this video, please rewatch it. It's available on my YouTube channel, Ibinabo Enebi. Please send this video to your friends. And if you have any questions, you can leave your questions in the video. And trust me, I would get Dr. Goma to answer those questions for you. So, hey, it's time. And I just want to say thank you. And Doctor, I'll call you. And bye, everybody.
See you later. Thanks for the invites.
Thank you very much.